Well, thank you guys for joining us today, Laura and Joan. It's really great to have you. Again, we're really excited about the partnership with Three Holy Women and the Family of Four Parishes for September. So we're really great. It's really great that we were interested in learning more. We're always really happy to share our work today. So I'm Alyssa. I'm the development coordinator here. I'm joined with Curtis, who is our volunteer coordinator. So we'll discuss some volunteer opportunities at the end. And then, so before, if anyone hasn't heard of Guest House, we provide shelter to 86 men on any given night. But as you'll see from our logo and throughout this whole presentation, we are going to go over all the ways we are more than shelter, because we really are. We provide so many services and are partnered with so many services that we really are more than shelter. So we're really excited to make that a little more well known and give more information about that. So we're going to get started. First, before we jump into Guest House, we do like to look at some data about the community and where we're at in homelessness as a whole, and what we're doing to combat that. Okay, so as right in front of you, you have the point in time count. It's a lot of data, but this count is done every year in January within the last 10 days of the year on any given night. So this is done every year. And this is to look at all the individuals who are experiencing homelessness on that given night. So the first line here that we'll look at is January of 2021. And total, there were 817 people who were experiencing homelessness on January 27th when this was done. Of that 817, 647 were in emergency shelters. So again, that could include a guest house, but all the other shelter options that are available. 107 were in transitional housing. There were 46 in safe havens. And then 17 were counted as unsheltered. So those are individuals who were sleeping in tents out on the street in places that were not meant for habitation, I should say. You'll see that 17 is significantly lower than the other years, which really is exciting to see that number so low. And there's no official data on it, but something that we really believe is the reason why that number dropped so low is due to COVID, due to all these things. Let me see. Yes. So due to COVID, we couldn't do the traditional warming room style. So in the winters, warming rooms are available for people to have that one night stay in shelters or other areas to get out of sleeping on the streets when the weather is below zero. So instead, so for 2021, it couldn't happen that year, especially within Guest House, just to maintain social distancing. So what the county did, or what the city did with that funding, is they provided hotel vouchers. So these hotel vouchers were distributed, and people really took advantage of them. And it wasn't just for one night stay, 2 night stays. We've had individuals stay there for a couple months. So we really think that that hotel voucher really filled a gap that we didn't know was there. So that's really exciting to see. Laura, I did see your question on how this count is done. So anything for the emergency shelter, transitional housing, and safe havens, that's all through the data through Impact 211, which we'll actually talk about in the next slide, I believe. And then for the unsheltered individuals, they will actually send out street teams. The Milwaukee Continuum of Care will send out street teams to go to the most common places where we tend to see individuals, not so much tent cities, it could be tent cities, but where people normally kind of set up shop in that respect. So again, unsheltered, it's hard to get that number, a really hard concrete number, because we could have missed a couple people, but compared to many years, that number is significantly lower. And then another thing we just like to point out is the difference between 2016 and 2017. Highlighted over here, you'll notice a significant drop, a difference of about 500. And so that's something we really like to point out. During that time, Impact 211 developed the coordinated entry process for shelter, which we'll actually talk about in the next slide. And then the Housing First approach. So Housing First is a approach, a philosophy style, but also it's actually a housing program as well. But Housing First, in a nutshell, is really taking away all the barriers to shelter, to housing, really just getting out those barriers out of the way so people can easily access and get their needs met. So whether that be shelter, whether that be housing, not having those prerequisites, like for shelter, for example, you don't have to maintain sobriety by any means. You don't have to be seeing a mental health therapist. If you're experiencing some mental health issues, that's something you can definitely do, but we don't require that. So because of that and that Housing First approach, we're able to serve the county, the city is able to serve many more people, and that's why you'll see that significant drop rate there as well. So as I mentioned, Impact 211 is really, really great. They are there to answer any questions or refer you to any sort of social service need that you might have, whether that be shelter, of course, but maybe you need an emergency food pantry. Maybe you need a clothing site. Maybe you need a meal site to eat dinner that night. You can call 211 and they will refer you. They really have a database with all that information of, the locations, what is closest to you. If you're taking the bus, if you're walking, you don't want to travel across the city, they can give you that information, their hours and things like that. And then 211 in shelter has a coordinated entry process. So what they do is they actually manage our wait list for a bed in shelter. So no longer are the days of, you have to pack up your items at 7 o'clock in the morning, take them with you and leave for the day, and then bring everything and yourself back at, 5 o'clock and stand in line. That's a really outdated approach. With Impact 211, you are notified when a bed is available if there is a wait list. So individuals can come in on that day that bed is available, and then that bed is their bed until they're exited from shelter. So they have a safe place to store their items and come home to, or come back to, I should say, until they are ready to leave. This is one more slide about some data. This looks at the calls to Impact 211 from January to December of 2020. As you'll see here, men are represented by that gray bar, followed by women, and then followed by families, and then youth. Really, really small number, but you'll see just a small line right there. And as you can see, the category of men, they are the highest number of calls for emergency shelter. So Guest House, we are a single men shelter site. And coincidentally, men typically are the #1 callers for emergency shelter, at least for 2020. It is important to note that anytime you call 211 in regards to shelter, every time you call, that number is recorded, and that is part of the numbers you're seeing in front of you. So even if you were calling to update your information, you got a new cell phone, you need to update that information so you can be notified when a bed is available. You want to check, the wait list, where you are on the wait list, anything like that. Anytime you call, it is reflected in those numbers there. So that's important to note as well. Alrighty, so we are going to get into the work of Guest House. I'm really excited about this part. If you have any questions, feel free to put them in the chat. You can hop in at any time to ask those questions. But Guest House, again, we are a men's shelter on site, serving 86 adult men on any given night. Due to COVID-19, our numbers are around more 65 to maximize social distancing. We've had to do a little rearranging of the dorms. But over the years, we've really added a wide array of programs, services, housing programs, ancillary programs to really meet the needs of the community. So not just, you need a one-night stay, but really, preventing, working with people who are at risk of being homeless, individuals who are currently experiencing that, and anyone who has a history of being, chronically homeless. We try to hit every single one of those points and provide services. So altogether, we serve 1,200 individuals every year. That's men in shelter, but also men, women, and families in the greater Milwaukee community through all those programs. This is our location here. If you've ever volunteered at Guest House, you might be familiar with it already. To your right, you'll see that original Cream City brick building. That's where all 3 of the dorms are located. And then to your left, we have the new expansion that we did in 2016. So still relatively very new. This is because we are just rapidly growing. To this day, we're rapidly growing our teams and all these services we're adding. So we did an expansion in 2016, so really added a ton of office rooms, conference rooms, storage areas, and our mental health clinic is actually part of that expansion as well. So on the first stop, if you were to come to Guest House, or if you have, stopped by a Guest House or volunteered here, you would be met with the residential services team. So they are more than just, a front office staff. They do so much for Guest House. They are really the communication hub of the building. This team provides coverage 24/7, and that's things from safety and security, as you'll see there, client needs, the emergency management. They're really the first and last stop for anyone coming into Guest House. So whether you're a volunteer, a donor, you're dropping off dinner for tonight, all the clients, of course, any community clients, so anyone who's here to see their case manager, their housing case manager, things like that, they'll stop by residential services to check in, and they'll call their case manager to meet them for their appointment. They do, deliveries, receive deliveries, all the things. So that's why we call them the communication hub of the building, because they really are. So we're really happy to have them. We have such a great team here, and I hope you get to meet them soon when we introduce volunteer opportunities again. A couple more responsibilities, if you'd like to read those. One thing on this slide that I really like to point out is our community resource window. So right over here, this is what it looks like from in the building. This is our community resource window, also known as our sandwich window. We do give about pre-COVID 250 to 300 sandwiches a day out this window to the greater community. So essentially anyone could ring our doorbell, ask for a sandwich, a big lunch if we have them, and then we'll give them through that. It's built to be like a drop window. So that's what you'll see down here. In the winter, we'll try to, if we have the supply, we'll try to hand out warm socks, hats, gloves, hand warmers, things like that. So not only trying to take care of everyone in shelter and in all our housing programs and external programs, but also the community as a whole. Alrighty, and then the next step would be emergency shelter. Case management, I should say, for emergency shelter. So you have some demographics over here if you'd like to look at those, but that's really anyone's next stop when they get to Guest House. So you'd meet, everyone has a case manager, every client has a case manager, I should say, and that case manager is there to really build that relationship with that client and help support them and develop a plan of action to meet them where they're at currently. What are their needs, what obstacles, what barriers do they have, and how can they help them move through that? And then what resources can they connect them to? Is it job placement? Do they need to immediately be connected to a housing program? Which housing program would be best for them? They're really there to provide that non-judgmental support through the clients on their journey. And we have a really great internal case management team here. So we're really lucky to have them. And then of the 86 beds that I mentioned for shelter, 52 are for the emergency shelter program. Typically, the maximum length of stay is 90 days. Due to COVID, we did lift that. So we actually have a lot of people here who have been staying much, much longer, but typically it's a 90-day stay. Then we have the Veterans Program. This is in partnership with the VA. And as you'll see here, they have the smallest dorm, but their dorm is fully equipped with many amenities. Again, some demographics over here if you'd like to look at those. But the veterans actually have, as you'll see in the top left photo, a shared common area. Past that, you can kind of see into their double occupancy bedrooms. They have their own bathroom facilities, showers, a full kitchenette, and then washer dryer. These individuals, we can serve 12 veterans at a time through this program, and they can actually stay up to 2 years. So again, emergency shelter has a 90-day stay typically. The veterans can actually stay up to 2 years at a time in their program. And then we have recovery housing. So recovery housing is our third component to shelter. So we have that emergency shelter for 52 men, and then we have our veterans, which is 12, I'm sorry, and we have recovery housing. Recovery housing can take up to 22 individuals, and they have more the medium-sized dorm. So it is another separate dorm that they have. Recovery housing is a really interesting and cool program. So this is through the larger CCS program, which we're actually going to talk about in 2 more slides. But this is a larger recovery-based life skills program. It's not a rehab by any means. It's really focusing on life skills, developing life skills to live independently for individuals who may have experienced or who are on their recovery journey. So they attend classes Monday through Friday, and these are a wide array of classes. So it could be budgeting and money management. It could be health and wellness. In the summer, there's a gardening class once a week. As we know, gardening can be very therapeutic. We have an art therapist. They could do music therapy. So really learning some recovery-based skills and opportunities to help them live independently as they move forward. So this is 22 individuals. That's the maximum we can take. And again, the individuals here can stay up to 2 years as well. And then from that, the guest house photo, I mentioned our counseling clinic. So we do have a mental health counseling clinic on site. This is not only available to the individuals on site, they could definitely be referred to the clinic, but this is open to the greater Milwaukee area as well for some of those housing clients or external clients. Again, that counseling clinic is part of that larger CCS program, which we're going to talk about in the next slide. But we do have a mental health therapist here. We have a team of about 4 of them. So we're really excited to be one of the first shelters to have this on site, to be able to provide this to not only shelter clients, but to the greater community. And then we have our CCS program. So this is comprehensive community services. This program is really a large, robust program, but it's really, really cool, all the things that they offer. So we are one agency that is involved with CCS. So it's a voluntary program. You do have to be enrolled in Medicaid, and you do have to have be diagnosed with a mental health and or substance abuse disorder. So CCS, we have 2 components here at Guest House. We have a care coordination team. So this coordination team, they have their own caseload of clients, whether that be individuals at Guest House or within elsewhere with another organization or within the Milwaukee County in general. And it's recovery focused. So those care coordinators can connect their clients to some of the services we offer here. So that clinic, if that's what the client is interested in, or the recovery housing program, if that was something of interest and they met that criteria. But we also at Guest House have some of those CCS opportunities. So recovery housing, the counseling clinic, we have 2 spiritual care wellness coordinators. We have a financial payee. We have a music therapist. So we have some of those CCS opportunities that those clients can be enrolled in and referred to. But otherwise, we have a care coordination team, and then there is many, many, many more services within Milwaukee that those clients can be referred to as well. It is a recovery-focused program, so the goal is to provide those recovery and rehabilitative resources to these individuals enrolled in that program. All right, I have a question from Laura, and it says, When men leave the veterans or recovery housing, where do they tend to go? Are they ready for their own housing, or do the men transition to another supported environment? I'm actually going to save this question for the end, but it is a little different for everyone. It just kind of depends on, where they were when they came in, and what kind of barriers they were focused or were experiencing, at their time at Guest House. It also depends on how many, if they exited on their own, where they are with their plan of services. So absolutely, a lot of them could have gone to some of the housing programs that we'll touch on in a little bit here at Guest House or with another service provider. But we do see a lot of them tend to go towards other longer term community resources or community services. But we do have a number of clients who enroll in some of our housing programs towards the end. So I hope that covers it, but I will come back to that question towards the end of the presentation as well. All right, so that was shelter, some of our CCS program, and we are now actually going to talk about some of those two housing programs. We kind of like to think of it as two umbrella programs for housing. So we have our interim housing here. These are just some of the options that we have. So we have homeless prevention. It is exactly how it sounds. It's really trying to prevent individuals from experiencing homelessness or shelter stay in general. So that could be someone who is getting an eviction, or they know that they are going to get an eviction, or they're staying, with a family member. So not completely homeless, category 1 homeless, but they are still experiencing that it could happen pretty soon. So they will provide short-term case management as well as a security deposit if that's needed, or a couple months rent, with the goal being that it gets that client's stabilized, income where they are in their, where they're at, that caused, whatever happened for them to lose their housing, their stable housing, and really trying to prevent, them from losing their housing and entering into shelter. And then we have our rapid rehousing, again, just as it sounds, trying to quickly get individuals into safe and stable housing so they can provide some of that rent assistance, security deposit, but also that short-term case management to make sure that case manager and that client work together and that client can be successful and live independently on their own after that relationship dissolves with the case manager. The VA TIP program is actually a very new program. TIP stands for Transition in Place. So that's very much new, and we're really excited about that one. That is for veterans only. So that program is a little different in that Guest House will actually sign the lease for an apartment or a unit for the client, and it's a really gradual and slow transition of responsibilities from Guest House to that client. And then again, that client will take on the lease toward, at the end of that partnership. The goal of it being really gradual and a little slower is really due to making sure that that client can live independently and keep that housing unit after he's worked with a case manager here at Guest House. So it could take some time. Some of these programs, when we say short term, it could be a year and it could be 2 years. So really short term doesn't mean just a couple months. It could be a year or two. These are two apartment complexes that we have, Prairie and Capuchin. These are very much independent living facilities, just like any other apartment. But the cool thing about this is that they have a Guest House case manager at both locations to provide any sort of emergency care coordination. If there is client needs that they can address right away, anything that they really need help with, there's a case manager there to be really supportive and make sure that that client can maintain that housing. Then we have Marcias House here. This actually launched in 2020, so we're really excited about Marcias House. It is a single family home that is owned by Guest House. It can serve up to 4 individuals who identify as LGBTQ, or and with a focus on transgendered individuals. So we can serve up to 4 individuals at a time. In this home, you do get your own room, and then just like any other home, shared living room, kitchen areas, bathrooms, laundry facilities, things like that. So we are really excited about Marcias House, and so far it's been full and very successful. So as interim housing, that's one part of the housing area. And then we have permanent supportive housing. So permanent supportive housing provides longer term case management. That interim housing provided more short term case management, really to help individuals stabilize. Permanent supportive housing is longer term case management for individuals who are experiencing chronic homelessness and individuals and families who may have a physical or mental disability. So we have 3 components to our permanent supportive housing programs. We have the My Home program, which serves 45 men and women in the Milwaukee County. We have the Housing First Housing Choice program. They can serve up to 60 men and women in the Milwaukee County. And then we have Homelink. Homelink actually rents 131 units for men, women, and families. This is the one program where we actually have a couple families enrolled into, again, providing some financial assistance, but also that long-term case management that this clientele need more long-term case management. Alrighty, so that was a lot of info. Now we're going to get into some ways to get involved. Curtis is going to share some volunteer opportunities, and then we'll kind of go into share on how your contributions also help here at Guest House.
All right, so I guess it's my turn, guys. So just to jump in on a few things here. Let me get my stuff together. So we do offer a few volunteer opportunities here at Guest House. The first of many, I would say, is our meal service program. And what that is primarily a dinner meal that is provided to the guest house by a group, a volunteer group, or it could even be an individual. And what they would do is prepare the meal on their own, in their own space, and because of COVID, drop it off here. In the past, before COVID, we used to have meal serving out of our kitchen to the guests here for dinner. But because of COVID, we have to go on with some drop-off procedures at this time. So we do ask that groups prepare meals for around 70 individuals. That number tends to fluctuate on a weekly basis, just as some guests come and go. So we kind of keep it at around 70 guests. And what that is pretty much preparing a hot meal. It could be anywhere from chicken to pasta to rice-based meals, anything you really think is a hearty meal and healthy meal to serve. And then moving on to another popular one would be our sandwiches and bag lunches. What we ask groups to do is 3 main things that we kind of highlight that are the most important is if you are preparing sandwiches that you date the bag. That way we know when the sandwiches were created, and that way we can follow our guidelines on how we rotate our sandwiches out of distribution. I'm sorry, the word escaped me. And then we also ask that we don't have any condiments on the sandwiches, as you know, it's very hard to store that long term. If you have ketchup or mayo or something on there, it kind of makes the bread a little soggy. So we ask that those are either put on the side, either in packets or just to exclude them from groups can typically make about 400 sandwiches at most, anywhere between 150 to 400 sandwiches. However, our peanut butter and jelly sandwiches, if you do make sandwiches that are peanut butter and jelly, we do ask that they are limited to about 100 sandwiches just because of the storage. Freezing PB&J sandwiches is kind of hard when it comes to defrosting them. However, our sandwiches are typically meat, cheese, and bread, just trying to stick to the basics so that they freeze easy and we're able to provide a good sandwich to some of them. Next up is the treat bags. Those are kind of popular now. Now that the Green City Gardens is kind of coming to a close, treat bags have become a much more popular option for people. And it's very simple to do. You can put together a group of people and supply anything from some fruits, some small snacks and things like that, protein bars, something that we can just give out to our guests throughout the day, and it can provide them with a little nourishment to get them through the day between meals. We do ask, however, if you are going to assemble treat bags, that fruit is left separately, and then we'll include the fruit with the treat bag as we go. And a lot of this information, if you decide to do something like this, will be included in a guide that I'll give you with a lot of more in-depth information for you to follow. One that is also, all of these are pretty popular, but this one has become more popular, decorating calendars. It's a nice, fun way to engage the entire family. If you have some young children or small ones that want to find a way to be involved in whatever it is that you're doing, and help other people in another way, or just brighten someone's day, decorating calendars is pretty fun to do. Putting stickers on there and, nice little messages and things like that are great ways to get them involved. And then also explaining to them afterwards what that means to people is definitely educational. And what that would be is, I would send you out a list of month calendars. Each month there's like a monthly calendar, and I'll omit like the months that have happened already, so that way you're not going to get confused about which months you need to do and which ones you need to leave out. It's pretty simple after that. And then you can print them out and decorate them in the way that you want. Lastly, our big one is Cream City Garden. That one has been very popular. It's probably the #1 opportunity that we offer. However, the unfortunate side is that it is seasonal. And that's probably what makes it so popular. It runs from April to September. And that's really a big group-based project. However, we do offer that for individuals. But if you have a group that wants to come out and just do something that's fun outdoors, and really get you involved, that's a good opportunity as well. You can join us at the Cream City Gardens across the street from our facility, help the garden tech with anything from weeding to planting new plants, or also harvesting. It's a really fun thing. I led a group myself, and it's been really fun out there. And I think that's all we've got for the big ones. I'll pass it off to Douglas.
Alrighty, so I think I mentioned Curtis and I share an office, so sometimes we get some of that feedback issues going on. And so then those were some really great opportunities that we're currently offering. Again, because of COVID-19, we're not able to offer those in person quite yet, but we cannot wait until we're ready to have everyone back on site. I do want to touch on some contributions and ways you can help if volunteering is maybe not for you. We always have a updated Amazon wish list. You can find it on our website. That is currently always populated with items in need. So anything that we might be in need of, you can purchase something on Amazon and it'll actually get shipped directly to Guest House. So really just a couple clicks and you're helping many people along the way. You could host a donation drive for items in need. If you'd like to do something larger, a little more planning. Again, you can make a monetary donation. Those are really great, and those really give us the flexibility to purchase really urgently needed items. If there's any sort of emergency within the facility with clients, we kind of have that monetary room to purchase those items. So that gives us a lot of flexibility. The holidays are quickly approaching. We cannot believe it, but the holidays are coming up soon, and every year we do an annual holiday gift distribution for everyone staying in shelter. So really we lay everything out for the gentlemen to help themselves. So that can include things like a new pair of jeans, a new sweater, new tennis shoes, a watch, a wallet, a belt, anything like that. So if you're interested in providing some of those items for some clients, definitely get in touch with us afterwards. And then the last thing is creating a household starter kit. Again, for all these individuals who are going into their new units, their new apartments, what better way to start than having a kit full of all your basic needs, some dishes, silverware, clean new towels, washcloths, things like that. And that is what we have for you today. If you'd like to learn more, you can visit our website. Curtis and I have our information listed there. Again, I'm the development coordinator. Curtis is our volunteer coordinator. So if there's anything that really sparked your interest, caught your eye, feel free to reach out with any questions. If you'd like to learn more or look for more ways to be involved, you can also find our information on our website on the Contact Us page as well.